Hi guys, welcome back to my channel. My name is Vera, and on this channel I talk about nursing, lifestyle, mom life, beauty, and just about everything. If you're an old subscriber, thank you so much for coming back, and if you're a new subscriber, thank you so much for joining the family. I bet you're gonna love it. In this video I'm gonna be talking about the do's and don'ts of using social media as a nurse. So these are the things that as a nurse you should and should not do. Stay tuned and watch this video to the end. So guys, I know we have social media now and we are trying to do a lot of stuff, but as a nurse you should not forget about HIPAA. Okay, you should not forget about HIPAA, because you wanna, I'm gonna leave a definition somewhere up about HIPAA, but you should not violate HIPAA and what it stands for as a nurse. When doing all those things on social media, you should think about your job, your future, and everything. And you don't want to take the privacy of the company you work for, the job you work for, or the patients you work for into the public. You shouldn't do that. But I feel like this is something that is not, said a lot. So I'm gonna be talking about the do's and don'ts, 3 do's, 3 don'ts of a nurse on social media or while using social media. So the first do's, or what a nurse can do on social media, is a nurse can post videos of professional tips, like what I come here and do. Okay, you can do that. You can post videos of professional tips, of health tips, or any new technology helpful. As a nurse, you can do that. You can post professional tips, nursing tips, new technology tips, or anything health related tips, okay, on social media. That's number one thing, or that's number one do's of a nurse. You can do that. It's okay to do that. The second do's I have for you all, my nursing friends, my nursing students, while using social media, is to create videos about medical breakthroughs or facts or things you've actually seen, or people or healthcare people which you want to give like shout outs to in your video. Okay, you can give shout outs to them, and you can actually post like any disease process or anything that has been helpful and you feel like it's health related that you want the public to see. That's the second do's of a nurse. Or you have like this doctor that is like worldwide that you want to give a shout out to, you can actually do that. Okay, you can post that on social media, or you can actually post like healthcare people who have actually made a difference and you want people to be aware. You can give them like shout outs in your videos and stuff like that. It's okay to do that as a nurse. The third do's while using social media as a nurse is you can do videos about being a nurse. You can give advice about the profession. You can give tips, especially as this will be helpful for people who want to become nurses in the future. So those are the 3 do's of nurses. I mean, I feel like the do's, it should be more of no blaspheming, but just coming and advising people and creating awareness without hurting no one. I'm gonna be talking about the 3 don'ts of using social media as a nurse. Number 1 thing you shouldn't do as a nurse while on social media is you should not use your job resources and take a video. I see a lot, it's happening a lot. I see a lot of people using like nursing stuff. They can have like IVs, injections, tests and things like that, and they take videos, and it's something that you should not do as a nurse, because you don't want to violate the privacy of that facility you work for and the resources. You don't want to violate that privacy. Okay, this might get you into trouble. So if you're a nurse that does that, quit, because you will get in trouble for violating the privacy by using this company's resources, even though it's a job you work for, but you want to actually cover yourself. Okay, you want to cover yourself from violating the HIPAA laws. The second don'ts, like do not do this as a nurse while using social media, is do not post about a patient. Like, this happens a lot. Do not post about a patient. I know social media loves these things, like people actually will love to see it hands-on, but no, do not post. Never you post about a patient. Okay, I came into work at 7 and my patient was distracting and the patient died. And I had a patient on, this patient is so needy, kept on putting on the call light, and finally I told the patient this, I told the patient that, I told the patient, I have everything you need. And can you imagine, my patient was on the floor? Sis, bro, do not. I know social media love these things, but do not. That's something you should not do. You should never talk about your patient ever on social media or while using social media. Tell me, a co-worker of yours sees that, or the patient's family sees that, and they know you're talking about their parent, or they know you're talking about their sister. How are they gonna feel? You think they're gonna, if it's a family that doesn't like those things, you think they're gonna let you keep on doing that on social media? No, you're trying to get yourself into trouble, because especially when you work at a place that you feel like everybody likes you. No, in a place, I haven't seen any place that everybody likes that nurse. There must be one person that want to bring you down. So you don't want to start showing those things on social media. Okay, you don't want to start showing those things on social media. And also, I've had a lot of comments like people telling me like to do a day in my life, like actually at work. If you want to notice my videos, I've actually never done that, because these are some of the reasons. Because you might actually do something with a pure heart and you're trying to, teach people like what you do and things like that, but someone might actually take it the wrong way. Okay, so yeah, for my subscribers, that is why you never see me posting. I can do a day in my life, like getting ready for work and coming back from work and things like that, but I've never actually posted a video like in facility and while doing like treatments and stuff, or about the job on social media. Okay guys, the third and final don'ts for nurses on social media, things that nurses you cannot do this, is do not post a negative comment about a family member, a co-worker. Okay, for example, if you're working for a job and you don't like that job, you hate it, you do not come on social media try to blaspheme, because what happens is when you go to your next job or when you go to apply for a job and those people that know you as a YouTuber, or those people there know you like a Instagram influencer, and they see all these things you've talked about, about this other company, they're gonna be scared to hire you. Trust me, they're gonna be scared to hire you. Or even if you like have 2 jobs and or they see like this video you've made about this other nursing job that you have or that you had, because they fired you for that, they're gonna fire you too, because they're like, okay, we don't want all those negativity, like we don't want all those things said about us, so let's just let her go. Okay, let her go. So yeah, do not say anything negative about a family member, a co-worker, or a job you work for. Just let it go, sis. Just let it go. You shouldn't come on social media and blaspheme and say all those things. Okay, let it go. You can say it within your circle, like out of social media, but you should not bring the things to social media. I mean, these are the the 3 don'ts I had for you all, and I feel like it's a lot of things people do on social media and you find yourself not getting hired. When you apply to these new jobs, you don't know why. But yeah, Facebook, Instagram, TikTok, all of these social media platforms, Twitter, all of these social media platforms, mind you, these employers, they watching, they looking at what you do. And there's one last thing I seen on TikTok. It was a fellow nurse on TikTok. She said what she does is when she gets to a new job, she actually goes to Facebook and actually like blocks all the co-workers that she finds on Facebook. And that's why whenever she goes to work, they always ask her, are you on Facebook? And she's like, no, because they don't see her on there. Because she said, girl, you need to block those people. Sis, you need to block them, because they act all, then, you know, when you want to call in to work or you don't want to come to work, they're like, but I saw her 3 minutes ago on Facebook. Yeah, block them, she said. Okay, she said block them, because you don't want people all up in your business like that. Okay, but yeah, I felt like I didn't think about that, like block all those employers from, you know, all your social media platforms. But yeah, you do not want to do, you know, these 3 things that I've, you know, talked about. But the 3 do's, you can do those on social media, but the 3 don'ts, don't do them, because you do not want to violate HIPAA. You do not want to violate HIPAA laws. Okay, but yeah, like I said, do these things and it will help you in your nursing journey. It will help you to keep you out of trouble. Let me say that it's gonna help you keep you out of trouble. I know we're trying to do it for the gram. I know we're trying to get people aware of stuff, but they're just some battles that you shouldn't take to social media. Okay, thank you so much for watching, and if you think this video is helpful or you have any comments, leave the comments down below. I love receiving your comments, and yeah, I'll see you in my next video. Bye bye.